The topic of discussion that we are going to have right now is we are going to talk about spinal cord, the external features of spinal cord. Okay, now what will be our pattern of study? Okay, now here initially what we'll do, we'll under this external feature we'll be talking about its extension, right? How it is extended, and then we'll be talking about meninges, right? The extents of meninges in our spinal cord, and then we'll be talking about what we'll be talking about ideal site for lumbar puncture, and then we'll be talking about spinal what pyometer modification, okay. Okay, and in this lecture we'll be covering these things, and in afterward we'll be talking about what we'll be talking about gray matter of spinal cord. Okay, now without delay let's begin our discussion. Spinal cord, right? Talking about its extension, in adult it is extended from C1 to lower border of L1, right? Lower border of L1. But if we'll see in neonates, what we will find is in newborn, what we will find is it extended from C1 to upper border of L3. That means as the child grows, there is upward shift of cord, right? Upward shift of cord, because initially it was till our L3 level, but as the child grows, it will be just limited to L1. That means there is upward shifting of our this cord, spinal cord. Okay, now this was about extent. Now talking about what is this? This is our longitudinal section of our spinal cord. Alright, this is our longitudinal section of spinal cord. Here, what is this? This is our base of skull. What is this? This is our base of skull. Okay, base of skull. Okay, and what we studied till now, it is extended from what? It is extended from C1 to our this L1 level. C1 to L1 level. Okay, now if you'll see it, right, if you'll see longitudinal section of spinal cord, we'll find that there are two enlargement. What are two enlargement? These one is this enlargement, and another is our this enlargement. Now what are these enlargement called? This above one it is called cervical enlargement, and below one it is called lumbar enlargement. Now why there are enlargement in our this spinal cord? Okay, these are why there are enlargement because these are the places, right? These are the places from where our maximum neuron nerve fiber will come, such as for example in upper limb region, what is there? There is our brachial plexus. So this cervical enlargement is the place, right? It is the place from where brachial plexus nerves will come out, right? And if you recall, brachial plexus root value for brachial plexus, it is C5 to T1, right? So if you'll see C3 to T2, right, root value is C3 to T2, so you'll find that brachial plexus, root value of brachial plexus, it will also come under these, right, under these level. So cervical enlargement, there is cervical enlargement. Why? Because motor neuron from muscle of upper limb, or the motor neuron of brachial plexus will come out from this region. That's why. And talking about this lumbar enlargement, obviously the same story, but here lumbar plexus, the nerve of lumbar plexus will come out from this region. That's why it is large, right? Many nerves, they need to come out. And these here the root value is L1 to S3, and here this L1 to S3, these are root value. These are spinal nerve coming out of this area. Here we are not talking about vertebral level, because just remember we are talking that spinal cord, it is extended from C1 to L1 only, and here we are saying it as 3, right? So we need to use our common sense that here we are talking about we are talking about spinal segments, we are talking about spinal nerves coming out of this area, right? Okay, so these are the two enlargement in our spinal cord. Now moving a bit down, what we will find is the end, right? The end point, terminal part of spinal cord is our conus medullaris. It is present in L1 region. Okay, now if we will see more carefully, then what we will see is, now there is one small extension of our this spinal, let's say spinal cord. We can see what is this. This is one small extension. Now this extension, this is nothing but this is our pyometer. Okay, meninges, if you remember meninges, PAD, right? Pyometer, arachnoid meter, and durameter. So this is what, this is our pyometer, right? The innermost one, meninges, that is extended from the base of our spinal cord all the way to coccyx, right? Coccyx. Now what is this thin film, right? Let's say thin extension that is extended from this conus medullaris to our this coccyx. This is called phylum terminal. What it is called? It is called phylum terminal. And this phylum terminal is what? This is the extension of pyometer. Let's not say just the extension of pyometer, because this phylum terminal, it is divided into two parts. One is this above one, right? The structure above our this S2 level, right? S2 level. Above this S2 level, it is called internal phylum terminal. You can see internal phylum terminal, right? Internal phylum terminals. And below this we call what? We call this as external phylum terminal. Now internal phylum terminal, it is not just a extension of pyometer. Here at the side you can see what? Durameter and arachnoid meter also. So this internal phylum terminals is the extension of pyometer plus what? Durameter and arachnoid meter. But below here we'll see what? We'll see only what? We'll see only pyometer. So it is called what? It is called fibrous matter only. What it is called? It is called fibrous matter. Okay. Now just if you'll see this region, if you'll see this region, this much region, the region of internus phylum terminal, if you'll see here carefully, what you'll notice that here in this region there is no spinal cord, right? There is no spinal cord, but there is the presence of what? There is the presence of cerebrospinal fluid. Okay. So in this region what we can do is we can do lumbar puncture in this region, because if you do lumbar puncture in this region, then what will happen? That we'll get CSF for our examination, and it will not affect spinal cord also, right? So the site of lumbar puncture is from our L1 to S2, L1 to S2. And more precisely what we do is we just do lumbar puncture from our L3 and L4. Why don't we go all the way down to what? Our L5, because L5 is sometime it is fused with our what? Sacrum. That's why. So this was about what? This was about our what? About lumbar puncture. Now moving further, okay. So that was about our lumbar puncture. Now moving further down, the thing that we need to discuss here is we need to talk about Cala Equina. As we have already mentioned that what? As we have already mentioned what? Our spinal cord and vertebral column, right? They don't go parallel all the way to down, right? Because why? There is upward shift of cord during development. So here one thing that we need to know here is, okay, there are root of nerves, right? There are root of nerve that arise below our L2 level, below our L2 level, right? L2 level, but they do not leave vertebral column at same level. Why they do not leave vertebral column at same level? Because obviously spinal cord is not up to our that vertebral column. That's why. So eventually what will happen is that all the nerves that are supposed to what? That are supposed to pass below L2 level will pass from this region only, from this region only. Everything will pass from this region only. Eventually branches of nerve extend caudally from lower end of cord around, right? Around our this region. Now because of which you will find what? You will find the tuft of nerves at this region, and these tuft are as what? Horse tail in appearance. So these are called Cala Equina. What these are called? These are called Cala Equina. Okay. Now what are these nerves? These are the part of our peripheral nervous system, right? PNS. Now if there will be injury in this Cala Equina, then what will happen? There will be what it is called? It is called Cala Equina syndrome. That is compression of Cala Equina, right? Compression of Cala Equina. If it will happen, then what will happen? There will be effect of what? Our these peripheral nervous system, such as paraplegia, saddle anesthesia, and sphincter disturbances. That are what? That are the result of what? Our this Cala Equina syndrome. Now what will happen if there will be what? Our this there will be problem at this region, our conus medullary region. What is conus medullaris? Conus medullaris is the terminal point of what? Our spinal cord. If there will be what? Lesion in this region, then what will happen? Not only PNS, right? Here there were neurons that were coming out of this area. Not only PNS, but also CNS. What manifestations will occur? Why? Because here there is inflammation in this conus medullaris, and conus medullaris is a part of our spinal cord, and spinal cord is a part of our central nervous system. That's why. So there is another conus medullary syndrome that will cause what? That will cause a manifestation of PNS and CNS. So this was about what? This was about our Cala Equina and Cala Equina syndrome and conus medullaris syndrome. Okay, now let's move further. Now here further what we need to know here is we need to know about spinal pyometer modification. Now we are talking about this one only, spinal pyometer. Now this spinal pyometer modification, there are three modification. One is phylum terminal. We talked about this final terminal, right? Final terminal internal and final terminal external. Internal there were what? All the meninges, PAD, and in external what? There was only our pyometer. So another modification is linea splendens. Now before getting into linea splendens, I would like to what? Make you clear about the literal meaning of this linea splendens. Now what is the meaning of linea? Linea means what? Line simply, and splendens it means what? It means bright, right? That means it means bright line. Okay, now this is the transverse section of what? Our spinal cord, right? Okay, now here inside this gray one, it is what? This is our, what is this gray one? It is, what is this? This is our gray matter, right? And outside this is our white matter, right? Gray matter, it is made up of what? Cell bodies. White matter, it is made up of axons. Okay, now here if you'll see, there are what? There are two fissures. One is present anteriorly. Okay, let me just write you, this is the anterior side, this is the posterior side. Okay, now there are fissures right here. What are these fissures called? These are called anterior median fissure. Why anterior? Because present anteriorly. Why median? Because present in midline, right? Midline, that's why anterior median fissure. Okay, and above we have got what? We have got septum. Okay, now I would like to tell you about what? This pyometer. What is this pyometer? It is what I call it as what? The most faithful layer of brain and spinal cord. Why most faithful layer of brain and spinal cord? Because it will what? It will be found in every part of brain and spinal cord. It will just get into any region of our this brain and spinal cord. I mean, it will cover brain and spinal cord in any region. So now since this pyometer is present on the exterior of our this spinal cord and brain, it will what? It will go all the way into what? These our anterior median fissure. Now as it will go inside this anterior median fissure, what will happen? It will be seen as what? It will be seen as bright line, right? Bright white line, and that way what we call linea splendens. So linea splendens is also the spinal pyometer modification. Okay, now let's move toward another, that is ligamentum denticulatum. Now talking about ligamentum denticulatum, now what we need to do is we need to see longitudinal section of our this spinal cord. This is the longitudinal section of spinal cord, and right, this is our spinal cord. What we'll see is we'll see what? We'll see ligaments, right? We'll see ligaments on either side. What is this? This is one ligament and this is another ligament. And this ligament, what they are having is these ligaments are having projections. Now total how many projections are there? 21 pair of projection. On each side 21, right? So on both sides 21 pair of projection. Okay, so now if you'll see this ligamentum denticulatum in transverse section, then we'll see these like this. What are these? These are ligamentum denticulatum. Now what is the importance of this ligamentum denticulatum? Okay, now if what is this? This is our transverse section. Okay, let's suppose that this is our spinal cord, right? We have cut it like this and we are just viewing it from above. So what is the significance of this ligamentum denticulatum? Is that the significance of ligamentum denticulatum is that it helps to what it help us during what our surgery. It acts as surgical landmark. It acts as surgical landmark. That means while doing surgery, it helps us to know that we have reached the midpoint. We have reached the midpoint of spinal cord. So that is the important. That means it acts as surgical landmark, right, of during the time of sectioning of spinal cord. Okay, I hope you are clear now. Okay, now how many ligamentum denticulatum are there? I have already said that there are 2 ligamentum denticulatum, because there are 2 ligament, right? This is the one and this is another. There are 2 ligament of denticulatum. But how many pair of projection, or how many projections? 21 pairs of projection, or total 42 projection. So this was about what? This was about our ligamentum denticulatum, or this was about all about our what? Spinal pyometer modification, phylum terminal, ligament linea splendens, and ligamentum denticulatum. This was all about what? This much. So I think, okay, this much for what? This much for external feature of spinal cord. Now after this lecture, we'll be discussing about gray matter of our spinal cord, or nuclei of spinal cord. Okay, that's all. Hope you have a great time.